Hi everyone, my name is Kayla Watanabe. I'm a graduate student at the University of Hawaii, and today I'll be talking to you about my field experience site and the lesson plan that I had made. So to start, I did my internship at Kapi'olani Medical Center in the Food Nutrition Department. Kapi'olani Medical Center is one of 4 hospitals under Hawaii Pacific Health. This includes Kapi'olani, Polimomi, Straub, and Wilcox. Hawaii Pacific Health's goal is creating a healthier Hawaii, and Kapi'olani Medical Center is recognized as Hawaii's leader in care for women and children, and is Hawaii's only maternity, newborn, and pediatric specialty hospital. It is also a major teaching site for the University of Hawaii John A. Burns School of Medicine. My supervisor was Allison Bright. She is the clinical nutrition manager, and she oversees all the dietitians. She's an RD and LD from Hawaii and got her undergrad from the University of Hawaii. As the clinical nutrition manager, she oversees all dietitians and diet aides. She creates reports for each inpatient's calorie and nutrition intake so that physicians can accurately distribute medication. Through this internship, I worked to get all the hospital's inpatient menu selections. I made tube feeding and NICU formulas. I also worked closely with dietitians to create meals for patients with special diets. My career goals are to become a registered dietitian and to practice medical nutrition therapy at a hospital. I plan to finish up my didactic program in dietetics education requirements by the end of spring 2021. Then apply for the dietetics internship programs. My dream program is at UC Davis or UC San Diego. So the learning plan was used to create learning objectives that I wanted to achieve through the internship. And I talked to my supervisor and also took notes on what type of skills are required to be successful as a dietitian. As you can see, I created a learning objective, then listed activities that would help me to achieve the objective. I then set a baseline that would allow me to know when I achieved the goal. The top 3 goals I set for myself were to effectively communicate with patients and physicians, learn proper food safety techniques, and to learn the different types of diets and how they can affect the patient's health. The lesson plan allowed me to gradually plan out when I would accomplish each of these activities. The reason I selected these objectives were because they were attainable, challenging, and I felt that they would help me be successful in the future. The hardest objective I set was effective communication with patients. This took the longest to complete since I worked my way up to perfecting my patient interactions. I also completed a lot of readings and modules on food safety and have used proper food safety techniques. Learning proper food safety was essential to being able to make the tube feeding and NICU formulas. My last objective was to learn about the different diets that could be prescribed to patients. We get a lot of carb control and low-fat diets, and it's really important that the dietitians check the menus before food is sent to the special diet patients. For carb control patients, insulin is administered based on menu selections and how much food is actually eaten off the plate. How did my learning goals connect to my future career goals was that I was able to experience the food management side of the hospital. I didn't realize how much planning goes into it and how dietitians work with cooks and food service workers to ensure proper portion sizes. The COVID-19 pandemic has also created an interesting learning experience at the hospital. I'm still able to work there even while, we've been told to stay at home. And I've really been able to see how the hospital kind of reacted and took different precautions, and how the dietitians kind of had to change how they've been working to go with the hospital's new plans. So the biggest professional skill I learned was having a lot of patient interactions. For this internship, I was shy and timid, and talking to patients kind of made me nervous, but as my training went on, I was able to continue to talk to them and really work on my effective communication. And this has really helped me in school. Now I can kind of present without being nervous. I feel a lot more confident. So my recommendations would be to put yourself out there. It's important to do things that are out of your comfort zone. Almost all of the work I did was talking to patients, nurses, and dietitians. And before this, I was, again, like I said, I was really timid and nervous when it came to public speaking. but I made myself practice it, and I've been able to like really get out of my comfort zone. I would also say introduce yourself to more people. Like, you never know if it'll be helpful in the future. I would say ask a lot of questions. No question is a dumb one. You can learn a lot by just asking. And then you'll be giving a lot of constructive criticism, and it's not meant to hurt your confidence. It's really just to help you in the future. Don't take it to heart, but remember it for the next time. Thank you so much.